Siamo in compagnia del dottor Andrew McKenzie, ideatore del sistema Clearstep. Buongiorno dottore, come nasce l'idea del sistema Clearstep?
Clearstep really was given birth basically by questions from my patients. My patients used to come in to me as adults saying they wanted to have lovely, beautiful smiles, but unfortunately because of fixed appliances with wires and brackets, they were really very self-conscious about wearing that type of brace, and therefore, as we know, the growth in adult orthodontics has been based upon let's go invisible, let's try and do a system where the patients can't see that they're wearing braces, and out of that the system was born. Obviously there are other clear positioner systems in the world. However, I identified some 20 years ago that it really would not be possible to treat, in my opinion, very difficult malocclusions or problems in orthodontics just by using clear positioners, and hence you'll notice in our company name it's the Clearstep system. In other words, we use a number of appliances to be able to allow us to do invisible orthodontics to high quality.
Quali sono quindi i vantaggi sia per il paziente che per il professionista?
As a patient, the demands were really that they wanted comfortable, easy to wear, affordable, so they wanted a system that nobody knew they were wearing them, that didn't affect their speech, but it's more complicated than that. As you can imagine, as a patient, you want to have invisible orthodontics, but you also want to make sure that you do achieve a wonderful smile, but also you want it to be quick. So there is the biggest dilemma, trying to get a system that's quick. As far as the practitioner is concerned, the practitioner wants to have an easy-to-use system, so we tend to use the term plug and play in computer technology, and basically that's what the orthodontist and the dentist really wanted, a system that was easy to pick up and use, and that's what our drive in the company do, is to try and make a system that is affordable, effective, and most importantly, easy to use.
Okay. So which types of malocclusions? Okay. Quali sono i tipi di malocclusione che possono essere trattati con il sistema Clearstep?
Basically what I tried to do with the Clearstep system is the kind of perception in the world about orthodontics is that clear positioner braces are only able to treat mild malocclusions, so you can only treat mild rotations, mild malocclusions, little crowding. You can't do you can't do treatment in children, you can't do severe cases, you can't do extraction cases. So what I set out to do some 15 years ago was I wanted to try and see if we could actually use clear positioners to treat all types of malocclusions. I now can, with our combination approach, using sometimes removable appliances, sectional fixed appliances, clear functional appliances, I now am fairly confident that I can treat every type of malocclusion out there. So I routinely treat extraction cases, I routinely treat children, as can all my colleagues who use the system, and more recently we're moving into orthognathic surgery and be able to do Clearstep prior to surgery to the jawbones, and now I know that we can really treat every type of malocclusion out there. If you have the skills as an orthodontist, or if you're taught them in a hands-on course as dentist, then you really can treat the vast majority of orthodontic occlusions using Clearstep.
In che modo è stata integrata la tecnologia 3D?
3D technology is obviously extremely exciting for all of us. Our laboratory uses a combination approach. In other words, we've used up until now either a manual process using microscopes where technicians with artisan skills are able to move the teeth under microscope control into precision positions. However, we realised that if we wanted to make the company large and to take the company worldwide, we would need to have more precision in our movements, more reliability, and therefore we moved into 3D. So we're really at the moment now using laser scan and CT scan technology to scan our impressions or models, and then in our software Clearview, which we've recently released, we're able to manufacture the positioners with a very detailed 3D laboratory using similar software to the other people in the market.
Come vede il futuro quindi del sistema Clearstep?
My hopes and aspirations for Clearstep are that with the thousands of practitioners who use our system in the countries already using it in Europe, the feedback has been very positive. Our aims and aspirations for the company are that we would like to deliver the same quality of service and customer support to the rest of the world. So our intentions are to take Clearstep global. One of the major differences in our approach to orthodontics with clear positioners is that we do feel that it's extremely important that the practitioners out there either be specialists using the system as they have the diagnostic skills themselves, or more importantly, if you were a general dentist who is using our system, that you need to have customer support, monitoring, mentoring and guidance by specialists. And therefore one of the major differences in our company is that we have a specialist board where every case sent in by a general dentist is diagnosed and treatment planned by specialists, and our hope is to run the same model out throughout the whole of the world in the next 18 months.